1, 2, 3, go. I have shoes on. Okay, my name is Tate Singleton. I'm going to talk to you about contraception before the age of 16. So within the past several years, it's been an argument whether or not doctors should be able to prescribe contraceptives to girls before they're 16 years old. And a lot of people would argue that a girl shouldn't have a need for contraception before 16, but the bottom line is that in some cases they may. So if a girl is choosing to have sex at any age, that's her choice. She shouldn't have prescription contraceptives withheld from her just because of her age. So researchers Sonia Brady and Bonnie Felcher from the University of California at San Francisco studied a group of 270 sexually active students, 56% of those were girls, from 2 separate schools in California. 100% of those girls were sexually active before 10th grade. So most people in 10th grade, they're between the ages of 15 and 16. So those 15-year-olds, if they're having sex in 10th grade, they don't have access to contraceptives. Alright? So, alright. An article posted to safeteens.org says that a teen that is sexually active and does not regularly use contraceptives has a 90% chance of being pregnant within a year. So if they're 15 years old and they're having sex and they don't have contraceptives, they're probably going to get pregnant. A writer for the Association of American Medical Colleges, Gina Shaw, said that the majority of girls begin menstruating at the age of 12, but as early as at the age of 8. So if a girl begins menstruating at 12 years old and she decides that she needs contraception, she may not have access to the contraception that best suits her needs. She shouldn't have prescription contraceptives withheld from her just because of her age. So for some girls, contraception isn't needed because they're sexually active, but because they have a medical condition that could require it. Like some medical conditions such as polycystic ovarian syndrome or PCOS, like the symptoms that come along with that are terrible cramps, possible infertility, and they don't ovulate normally. So if they're unable to get contraception, and they have this condition that's diagnosed before they're 16 years old, then not being treated can actually cause them to be diagnosed with absolute infertility. The fact that contraceptions can help prevent pregnancy or treat a medical condition, the availability of prescription contraceptives to girls at any age would reduce the abortion rate among teens that become pregnant. According to an article posted to choicespregnancy.org, 35% of all teens that become pregnant choose abortion over having a child. So ultimately, I think that any female that is sexually active, has a medical condition, or just feels that she needs contraception should absolutely have access to it. She should never be turned away because of her age. Her body, her choice.